For centuries, medicine relied more on what could be seen, touched, or described than on what could be heard inside the human body. Physicians in antiquity and the Middle Ages mastered observation, pulse-taking, and palpation as their main diagnostic tools. Hippocrates, the so-called father of medicine, already emphasized the importance of listening to the patient. But this listening was mostly metaphorical. It meant hearing the patient's story, examining visible signs, and drawing inferences. There were, however, rudimentary attempts to listen to internal sounds. Hippocrates himself described a technique known as the succussion method, shaking the patient and trying to detect splashing noises in the chest caused by fluid. It was crude, imprecise, and uncomfortable, but it hinted at the possibilities of auditory diagnosis. By the 18th century, some physicians practiced what became known as direct auscultation, placing the ear directly on the patient's chest or abdomen. This was not a universal practice. Some considered it unscientific or even improper, but for physicians concerned with heart and lung disease, it offered invaluable clues. At the dawn of the 19th century, European medicine was in transition. The French Revolution had transformed hospitals into teaching institutions where doctors could study large numbers of patients, compare findings, and build systematic knowledge. In Paris, hospitals like the Hôtel Dieu and Necker became laboratories of clinical medicine. It was within this fertile environment that a young physician named René Théophile Hyacinthe Laennec would radically change how doctors listened to the human body. René Laennec was born on February 17, 1781, in Quimper, a small town in Brittany, northwestern France. His early life was shaped by hardship. His mother died of tuberculosis when he was only 5 years old, and his father, unable to care for his children, sent René to live with his uncle, Guillaume François Laennec, a practicing physician in Nantes. This uncle played a decisive role in his life. From childhood, René was exposed to hospitals, medical discussions, and the discipline of study. He grew fascinated with the healing arts at a time when medicine still carried remnants of ancient traditions, but was beginning to be reshaped by Enlightenment science. In 1795, amid the upheavals of the French Revolution, Laennec began formal medical studies in Nantes, then moved to Paris, the beating heart of European medicine. There, he studied under prominent figures, including Jean-Nicolas Corvisart, personal physician to Napoleon Bonaparte, and a pioneer in the diagnosis of heart disease. Corvisart was a passionate advocate of direct auscultation, teaching his students to press their ear against the chest of patients to detect abnormal sounds. Laennec excelled not only for his intelligence, but also for his sensitivity. He was a deeply religious man, inclined toward poetry and music. He played the flute and guitar with skill. His artistic sensibilities shaped his meticulous and almost lyrical approach to medicine. Yet his life was also marked by frailty. Like his mother, he suffered from tuberculosis, though he managed to keep the disease at bay for most of his career. His personal experience with illness sharpened his interest in chest diseases and his desire to improve diagnostic tools. By 1816, Laennec was working at the Necker Hospital in Paris, treating many patients with lung and heart conditions. His clinical reputation was rising, but the limitations of direct auscultation troubled him. One day, a young woman came to him with symptoms of heart disease. He needed to listen carefully to her chest, yet the social conventions of the time made it awkward, perhaps even indecent, for a male doctor to press his ear against the chest of a young female patient. At that moment, a childhood memory surfaced. Laennec recalled how sound traveled more effectively through solid materials than through air. He remembered seeing children play by scratching one end of a wooden beam and hearing the noise clearly at the other end. Inspired by this principle, he rolled a sheet of paper into a cylinder, placed one end on the patient's chest and the other to his ear. The result astonished him. The heartbeat was clearer and louder than he had ever heard before. What began as a gesture of modesty and decorum turned into a scientific revelation. This improvised cylinder of paper marked the birth of a revolutionary instrument. Encouraged by his discovery, Laennec experimented with more durable materials. Soon he replaced the paper tube with a hollow wooden cylinder about 10 inches long and 1 inch wide. This simple object became the first stethoscope. Laennec coined the term stethoscope from two Greek roots, stethos, chest, and skopein, to examine or observe. The name itself signaled a new way of approaching the human body, through sound. He also introduced a new term for the technique, mediate auscultation. Auscultation performed with the mediation of an instrument, as opposed to direct auscultation with the ear alone. The wooden stethoscope could be dismantled into two parts, with a central bore that conducted sound. Though crude by modern standards, it amplified and clarified heartbeats, murmurs, breath sounds, and other internal noises. Laennec spent countless hours testing his device. At the Necker Hospital, he compared what he heard in living patients with what he later observed during autopsies. This painstaking correlation between clinical signs and pathological anatomy gave his work a scientific rigor unmatched at the time. In 1819, he published his monumental treatise De l'auscultation médiate. In 2 volumes, he explained his method, described the acoustic phenomena of the chest, and presented a systematic classification of lung and heart diseases. It was both a technical manual and a visionary text. The stethoscope was not immediately embraced. Many physicians were skeptical. Some argued that the instrument was unnecessary, that the ear alone was sufficient. Others mocked it as a fashionable toy or a gimmick. Caricatures circulated, ridiculing doctors who walked around with a wooden tube. There were even ideological objections. Some physicians claimed that the stethoscope distanced doctor and patient, placing a barrier between them and reducing the intimacy of medical care. At a time when bedside medicine was still seen as an art of closeness, the wooden tube seemed almost cold and mechanical. Yet, as often happens with great innovations, younger and more open-minded doctors began to adopt it. They realized its practical advantages, the amplification of sound, the ability to diagnose earlier, the greater precision in distinguishing between different diseases. Gradually, the stethoscope spread through Parisian hospitals and then across Europe. In the United States, too, it began to be used, though adoption was slow at first. By mid-century, it had become an accepted, if not yet universal, tool of medical practice. Laennec died too early to see the long life of his invention, but the stethoscope continued to evolve. His original monaural wooden tube was effective but limited. In the 1850s, Irish physician Arthur Relied developed a stethoscope with 2 earpieces, allowing the doctor to listen with both ears simultaneously. Shortly thereafter, American physician George Kamen refined this design and produced the first widely used binaural stethoscope. This innovation marked a turning point. The binaural stethoscope provided better acoustics and greater comfort, quickly becoming the new standard. Throughout the 19th century, further modifications were introduced: flexible tubing, improved diaphragms, and lighter materials. As medicine advanced, particularly with the rise of pathology, bacteriology, and surgery, the stethoscope became indispensable. It allowed physicians to diagnose tuberculosis, pneumonia, chronic bronchitis, valvular heart disease, and many other conditions with unprecedented accuracy. By the late 19th century, the stethoscope was not only a medical tool, but also a cultural symbol. To see a doctor with a stethoscope was to recognize authority, science, and healing. The stethoscope transformed medicine in ways far beyond its practical use. It introduced a new epistemology, the idea that the body could be read acoustically, that sound itself was a form of evidence. It turned the physician into a kind of interpreter, capable of translating hidden rhythms and murmurs into diagnostic knowledge. The chest became a resonant chamber, and the stethoscope the instrument through which its music could be heard. This shift paved the way for other diagnostic instruments. The blood pressure cuff, the electrocardiogram, the X-ray, all followed in the path opened by Laennec's principle, that mediation through instruments could reveal truths invisible to the senses alone. Even in the 20th and 21st centuries, with ultrasound, CT scans, and digital monitors, the stethoscope retains its role. It remains one of the first tools used in any examination, valued for its immediacy, portability, and symbolic weight. René Laennec died on August 13, 1826, at the age of 45 of tuberculosis, the very disease he had studied so intensively. He was buried in his native Brittany, far from the bustling hospitals of Paris, yet his legacy endures. Few inventions in the history of medicine have had such lasting influence. The stethoscope not only revolutionized diagnosis, it reshaped the image of the physician. Alongside the white coat, it has become the universal emblem of medical care. Today, more than 2 centuries after Laennec rolled that first paper cylinder, millions of doctors around the world carry a stethoscope around their neck. From the simplest rural clinic to the most advanced urban hospital, its presence is a constant. Modern stethoscopes include electronic amplification, digital recording, and even Bluetooth connections. But at their core, they remain true to Laennec's insight, a channel between the sounds of the body and the trained ear of the physician. The story of the stethoscope is a reminder that great scientific advances can arise from the simplest human moments. Laennec's sense of modesty, his reluctance to place his ear on a young woman's chest, led him to improvise a tube of paper. That act of delicacy sparked a revolution in medicine. In the wooden cylinder of Laennec, medicine found not only a new instrument, but also a new language. The stethoscope gave the body a voice, and through it, the doctor could finally listen with clarity to the hidden life within.